themes that we are looking at, have been looking at when working on this roadmap to recovery. And the first is making sure that the local public health infrastructure is in place. And when I say public health, it's not just the public health department, it's making sure that our hospitals have what they need to limit these outbreaks. Offices, they have what they need to take care of the outbreaks. The other theme that we're using, and it's a resource to guide our local reopening, is that map, that roadmap, that plan that outlines a phased reopening of the economy to protect the public's health while laying a strong foundation for a long-term economic recovery. Stage 1, which we just passed, was our safety and preparedness phase. We needed to ensure that our essential workers, they kept working in a very safe environment. It was also an opportunity to have conversations with our county local stakeholders to talk about what does it mean to recover, what kind of steps do we need to take in our community, and moving along in a safe manner, making sure that the health of our community is the priority. Supervisor Blancarte mentioned that the governor just yesterday released some of the guidelines, and so therefore, today we are in stage 2, which is the low risk workplaces and allowing those to reopen. So what does that mean? It's reopening with some adaptations, with some modifications. This means that several businesses can reopen and do curbside business, online delivery. Online had already been there, but those small businesses that decided to close, that was also an option for them in stage 1, online. So curbside retail includes bookstores, jewelry stores, toy stores, shoe stores, home and furnishing stores, sporting goods, music stores, florists. Mother's Day is coming this weekend, Sunday. I'm just going to take a minute to say, yes, flowers are great when you're a mom. I'm a mom. I like flowers, but keep in mind, we're still in the middle of this pandemic, at least in Imperial County. Take care of your mom. Make sure you practice social distancing. Face coverings are very important. So going back to the florist, they can start back up. And I hope my husband's listening. I want my flower bouquet. And then supply chains that provide these goods to these businesses. They are also allowed to reopen. The conversation since day 1 is what do we need to do to move into a higher, paced kind of move? What can we do to open up those businesses that are considered higher risk? Well, as you might have heard yesterday, the governor mentioned that some counties, given the readiness level, they may move faster than other counties. But what does that mean for us here in Imperial County? In Imperial County, we need to attest that the county is actually ready and meets the state's criteria for containing COVID-19. We need to demonstrate that there's low prevalence of COVID-19 and high level of readiness. Our local health officer needs to complete a written attestation or certification that we're ready and submit it to the state of California. And along with that, there needs to be a containment plan. So big question is, so what can take us to stage 2 higher risk? There's set criteria that has been set, and we're looking at, and we've been working at actually for the past several weeks. There's a total of 6. The first one is the epidemiologic stability. What does that mean? It's making sure that, our number of cases are stable and, we have no deaths in our community. That was the message yesterday. Those were the metrics relayed by the state of California. As far as the number of cases, it's no more than one COVID-19 case per 10,000 population. The second criteria is ensuring that we protect our essential workers. What that means is having guidance in place, and the state of California has quite a bit of guidance in place. And if you haven't visited the state's website, COVID-19 website, they've set aside a section for guidance for multiple sectors, guidelines and checklists. And then just making sure that the essential workforce has the needed supplies to continue working in a safe place. The third criteria is testing. We need to have a minimum daily testing capacity of 1.5 tests per 1,000 residents. We are increasing our testing capacity. Just this week, we started with the testing at the fairgrounds. There's several healthcare providers that are doing testing, as well as our hospitals. So that metric, that criteria, we're working hard towards meeting. And then just making sure that there's testing sites available within 60 minutes in rural areas. So again, testing capacity has been increasing over the last week or 2 weeks. The other three criteria, it's containment capacity. Containment capacity, that comes with our epidemiology team, making sure that there's enough contact tracing staff to do the investigation, the contact tracing, the delivery of isolation orders, the data entry. So that information that goes into our county's website, it's fed from the data that's received from these COVID-19 cases. We need to have 15 staff per 100,000 population. And the other metric is the availability of temporary housing for our homeless population. So we must have 15%, of housing available for. Let me state that again. It's temporary housing units for 15% of county residents experiencing homelessness and COVID-19. Hospital capacity, really important one, and we've been working very closely with both our El Centro and Brawley Hospital. For the hospital capacity, we need to accommodate a minimum of 35% surge due to COVID-19 cases, in addition to providing the usual care. The second metric is making sure that the hospitals have a plan in place to protect its workforce, both clinical and non-clinical, and that they have sufficient personal protective equipment on hand. Finally, taking a look at our vulnerable populations, making sure that, within our skilled nursing facility or facilities, that they have enough supply for at least 14 days on hand for staff to take care of those residents in those sites. And then making sure that they also have an established procedure so that they can secure this PPE from non-state supply chains. And then the final one that is not here, it's just having metrics and knowing when to step back if there is a surge in cases in Imperial County. So reinstituting, or going back to earlier stages if needed. Just going over a little bit more about stage 2, higher risk. Once that criteria is met, then this is what it means. Destination retail, including shopping malls and swap meets, are able to open. Personal services such as car washes, tanning facilities, all landscaping, gardening are able to open. Office-based businesses. Telecommute is still the ideal. If they are able to telecommute, stay at home, that's the recommendation. But if not, offices are able to open. Dine-in restaurants. However, facilities like bars or gaming rooms, those would not be permitted in this stage. But dine-in restaurants with certain measures, safety, social distancing measures would be allowed to open. Schools and child care facilities, and then outdoor museums and gallery spaces. Triggers for adjusting modifications, like I mentioned, If we meet all criteria, we move on to the higher risk stage 2. And a week, 2 weeks, a month later, we notice that there's a surge. Hospital capacity is no longer there. We're running low on protective equipment, whatever it be. We will go back, analyze, and reinstitute appropriate measures again, so that our community, our employees, are safe and when they're out and doing business or seeking services. Now, looking ahead in Imperial County, just like any other California county, we have the higher risk workplaces, and that is in stage 3. And this would include movie theaters, religious services, more personal hospitality services. Let me go back to religious services. So our faith community, those that provide an essential service, distribution of food, a certain mental health program, they are still allowed to remain open. What's not allowed is the mass gathering, the services. That is for a later stage. And finally, stage 4, end of stay-at-home order. That's the reopening of the highest risk workplaces. That includes concerts, conventions, sports arenas, the mass gathering kind of places. Now, I do want to stress that this is not a public health department effort. This is not a County of Imperial effort. This is an effort that will take this roadmap to recovery. It's the responsibility of every single one of us, starting with community members, residents of Imperial County, local hospitals, our healthcare providers in general, community clinics, schools, law enforcement, our cities, our faith-based organizations, chambers of commerce, public-private agencies, the media. We all play a very, very important role in this, and in order to move as fast as we want, it's going to be a collective effort. And with that, I will end my presentation. Thank you.